Thank you, Mr. Chairman. Thank you, Secretary Burwell. Your work covers so many areas that affect the daily lives of Oregonians and Americans. I appreciate that. I want to thank my colleague and friend, Representative Stefanik, for bringing up the Older Americans Act. I want to ask you about the Home and Community-Based Supportive Services Program that funds services like legal assistance, elder abuse prevention, transportation to meal sites, medical appointments, referral assistance for seniors and their caregivers. Now, I'm supporting the additional $10 million in the President's request, as well as many of my colleagues. Why is it important to increase funding for the Older Americans Act programs, especially the home and community-based supportive services, given the rapidly rising population of older Americans? And I do want to save time for another.
I'll just quickly say that I think there are two elements. It's about what it means for the individuals in terms of these programs we know are making a difference in terms of supporting people to be able to have care at home if that's what's appropriate for them. And so it's about the individual, but it's also about the economics as well in terms of the success of these programs contributes economically.
Keeping seniors in their homes less expensive. Thank you. The Oregon Health Science University has been working in collaboration with Intel on genome mapping. That's especially useful in cancer research. The goal is to make personalized genomic analysis faster, less costly, more routine. What are some of the challenges that research institutions face regarding the collection and sharing of information? And what opportunities might the Cancer Moonshot provide to overcome some of these obstacles in advanced precision medicine?
Some of the limitations are the fact that the areas of science don't work together, and you actually need an engineer to help deliver through the system. A biologist figures out what it needs, but an engineer actually delivers the delivery mechanism, and we have not broken down those silos as we think about the science. I think it can help with that. The other thing I think it can help with is data and information, because one of the things, and this is part of what precision medicine is about, is making sure that data and information can be widely accessed in safe, secure ways. That's both about privacy and cybersecurity. But that information can be used widely and broadly to discover and understand more quickly. It also in the end will save costs, because how one accesses information for trials will become easier and less costly, which is a very important cost element to drugs.
Thank you. I look forward to working with my colleagues on those important issues. And finally, I think my colleagues who brought up the issues with opioid overdose and abuse and all the resulting deaths. We've had an explosion in my state as well as in the country. I applaud your three-pronged evidence-based approach. And can you talk a little bit about the prong of improving prescribing practices, particularly important?
An extremely important part, and the Center for Disease Control and Prevention will be issuing new prescriber guidelines in terms of the issue of how we can talk about these issues and think about these issues, because one of the problems many physicians say, I don't know. I wasn't trained in this way. So we want to get those out and make sure people are using those, because when you think that over 250 million prescriptions a year for opioids, we know we don't need that many as a country, so prescribing is an issue. So we're going to target that as an issue, get out new guidelines, and then we need to probably work with the Congress to make sure those guidelines are used.
Thank you. And I know my state just received about $2.7 million to expand substance abuse services, particularly focused on treating opioid abuse. I know that's not enough. We still have more work to do. I had a fourth question, but the chairman asked already about preschool development grants, and look forward to watching how that hope the transition is seamless as the HHS continues to manage those grants. So I yield back. Thank you, Mr. Chairman.
Gentlelady yields back.